Hello, my name is Gabby and I'm going to be talking about hepatitis A. So hepatitis A actually has multiple types. It can be caused by viral, bacterial, parasitic, but hepatitis A falls under the category of a viral hepatitis. There's actually 5 main types: hepatitis A, B, C, D, and E, with the main types being A, B, and C. Hepatitis A is acute, while B and C have the possibility of becoming a chronic disease and are more known to be life-threatening. So hepatitis A is caused by the hepatitis A virus, or HAV. It falls under the family of Picornaviridae and the genus of hepatovirus. As you can see, HAV has a very simple structure, like most viruses. HAV is an enteric picornavirus, which means it spreads to and deals with the intestinal tract, mainly the liver, which I will expand on later. But as you can see, there's no envelope, and its genome consists of a single-strand RNA, and it has a VPG, which is a viral protein genome link, which is just a protein that's attached to the 5' end of a single-strand RNA, and it acts as a primer during RNA synthesis. So the HAV is actually quite small in size. It's only about 30 nanometers in diameter, as compared to viruses that can reach up to 500 nanometers in size. The HAV is actually very stable at low pH levels and moderate and frozen temperatures. So hepatitis A is mostly acquired through ingestion of food or water that has been contaminated with fecal matter of an infected person, with humans being the only natural host. Hepatitis A is actually highly contagious, and not in the way that you would think. It's not an airborne virus, so you can't get it if an infected person sneezes or coughs on you, but close contact with a person with hepatitis can infect you. So close contact meaning like like sex, or a person doesn't wash their hands and they handle food and they are infected, they can easily pass on a hepatitis A, but casual contact does not spread the virus. So typically, the average incubation period is 14 to 28 days, and the HAV replicates in the liver and is excreted into feces, which is why contact with an infected person's feces is so dangerous, because even the smallest amounts of the HAV can infect a person. A person is actually most contagious soon after they are infected and before symptoms show. And the viral excretion actually declines once the onset of symptoms begin. And by the 3rd week of illness, most infected people are no longer contagious or excreting HAV in their feces. Infection can range in severity from a mild illness lasting about 2 weeks to a very severe illness lasting 6 months. But only 10 to 15% of people have experienced relapsing symptoms for 6 months. And usually children under the ages of 6 actually do not show any symptoms. And hepatitis A is most known for causing liver inflammation and obstructing the liver's ability to function properly, which ties into other symptoms like diarrhea, fever, dark urine, and jaundice, which is the yellowing of the skin and the whites of the eyes, and the liver inflammation. Hepatitis A does not cause long-term liver damage. Usually people are able to recover from hepatitis A, but sometimes, usually in older adults or those with chronic liver diseases, they can experience sudden loss of liver function. And as mentioned before, hepatitis A has acute effects, meaning that most people recover, while hepatitis B and C, they become chronic and can cause long-term liver damage and death. Treatment and prevention include, well, there's no treatment for hepatitis A. The body naturally clears HAV, and treatment would be more focused on preventing further damage to the liver and trying to reverse existing damage but most cases of hepatitis A clear over time. Prevention is more important than trying to treat it because there is no treatment. Improved sanitation, food safety, and vaccination are the best ways to combat being infected with hepatitis A. The biggest one being the vaccine. So a little bit of backstory. There are reports of a disease very similar to hepatitis A as early as 5,000 years ago in China, and even Hippocrates recorded a jaundice-causing disease that very closely resembles hepatitis A. But it wasn't until the 17th century that more accurate descriptions of hepatitis A appeared. There was a large association between hepatitis A and war. The disease was common among troops of the Civil War, with over 40,000 cases reported, and it was present in World War I and World War II, with an estimated case count of 16 million between civilians and soldiers, which it makes sense why there was such a large amount during wars, because of how unsanitary their conditions were. And it wasn't until quite recently, actually, the late 70s, that HIV particles were officially discovered. Depicted here is Stephen Locarnini, one of the many scientists who put a lot of effort into the discovery of HIV particles. He was one of the first to identify HIV particles and correlate the virus to being a fecal-related virus when he was working with a patient with naturally acquired hepatitis A. And around the world, there are highly endemic areas like Central and South America, Africa, the Middle East, and Asia. Hepatitis A is commonly associated with unclean food and water, insufficient sanitation, and poor personal hygiene. So it is more prevalent in those developing countries, especially because they have less access to vaccines. And anyone at any age can get infected with hepatitis A, even a person who was previously infected. So that's why it's so important that, everyone has access to clean water or washes their hands very often. But there are people who are more at risk, such as people living in those poor sanitation conditions, consuming unclean water, living with an infected person, having sexual contact with a person with hepatitis A, using recreational drugs or sharing drugs, and traveling to places of high endemicity without being vaccinated. And talking about the vaccine, the hepatitis A vaccine was first licensed in the US in 1995, and then there was another one in 2001, which was a combination vaccine of hepatitis A and B. Surprisingly, the hepatitis A vaccine is not mandatory. Well, it would make sense because the US has clean conditions and won't be as much at risk, but the vaccine is still just recommended. However, there are 17 states that do require children going into kindergarten to be vaccinated, and Texas is one of those states. So for the vaccine, it is typically administered to 12 to 24-month-olds, and it is an inactivated vaccine of 2 doses, with the second dose following the first at least 6 months after, and the vaccine persists for about 20 years. There was actually an outbreak of hepatitis A in the US in 2019. So the locations of substantial amounts of reports included Kentucky, Mississippi, Florida, and Pennsylvania, all clustered around here. And as of November 2022, there were around 44,000 cases reported, with about 27,000 of them being hospitalized and 419 deaths. The CDC correlates this outbreak to the rise of cases beginning in about 2016. The outbreak was worse in areas of drug use, homelessness, and poor sanitation, which lines up with everything we've been talking about. And the US has been trying to counter the outbreaks with vaccination campaigns at these locations at both federal and state levels. In 2019, there was actually an outbreak in New Jersey as well, but it was isolated from the other outbreak of the cluster. It was believed to have been caused by a food handler at a golf club who was infected with hepatitis A, and he was deemed responsible for infecting about 27 people, and one of those people actually died. So with such a late onset of symptoms and the most contagious period being before those symptoms even show and you even knowing that you have it, is very easy to spread. So that's why it's very important to just wash your hands. Thank you for watching.